Okay, a couple things I want to point out on the slideshow here that I didn't get to do in the sim video. I just uploaded the notes that I went off of on these slides during the sim videoing. I know they're probably hard to read, but at least you have access to them. APGAR scores we went over in the sim lab. I just wanted to show you pictures of the wet, slippery kiddo. This is how the APGAR score is determined, which you have access to all this, so I'm not going to read it. Here's a nice little acronym if you have a hard time remembering what APGAR is. Identification bands, very, very important, so there's no mix-up at birth or when the baby goes home. Here's your gestational age assessment Ballard scale. It's very hard to see here, but you have access to that. Hopefully you get to practice that in the clinical setting. Here's some pictures I wanted to show you. Baby getting weighed. This is a good picture, an example of vernix, the white cheesy substance. And then a good picture of the acrocyanosis, the blue hands and feet, which is normal. Again, these are my notes. Here's some pictures. Here's a picture of meconium stool, which is the first few days of life for the newborn. Then it changes to a transitional yellow or greenish color. Bottle-fed baby's stool will smell worse than breastfed babies, and they'll have less bowel movements. Bottle-fed babies will. Here's a picture of Mongolian spots. They look like bruises. They are seen more on your some of your different ethnicities. Darker skinned babies have more Mongolian spots. This is Milia, M-I-L-I-A, so the little white pimple looking bumps on the newborn. That encourages parents not to pop these. These are normal, they will go away. Here's a baby getting a hearing screen done. And then here's a newborn getting a bath. I just wanted to point out they're not submerging the baby in water because of the cord. And also the swollen genital area, which is common in normal in your newborns. This slide you have access to, it crosses the suture line. This is your cone head babies. Here's your hematoma. It does not cross the suture line. Here's pictures of some of your reflexes, Babinski's. Here's a picture of how the vitamin K and hepatitis B is administered and where it's administered at on the newborn. Picture of a newborn screen. It's a heel stick. All lab studies are done by heel stick, and this is just the paper that a newborn screen goes onto. It tests for very rare metabolic disorders that if caught early and treatments initiated, it can prevent mental retardation and things like that. Picture of just a certain type of circumcision, and this looks like a plastibell. You want to know your education of how to tell a parent to take care of different types of circumcisions. There's a short video on neonatal withdrawal that I'll also post for week 6 for you to look at. I think it's about 6 minutes long. This is your scoring system. A picture of a small for gestational age kiddo there on the left. Picture of a large for gestational age kiddo on your left. And this talks about your, here's a picture of a preterm baby. See how translucent the skin is? You can see a lot of veins. I can't tell if this one's eyes are still fused. You know, and it depends on the gestational age of the baby, but this one's a young 20, I would guess 20, mid-20 some odd week infant. They're small for gestational age and a preterm infant are two different things. Small for gestational age is they're just less than the 10th percentile. Preterm infant is anything less than the end of 37 weeks gestation. So a preterm infant can be appropriate for gestational age, if that makes sense. Here's a picture of jaundice. You can see it kind of looks like a tan on a baby, the yellowing of the skin. Picture of a baby in phototherapy. Looks like a tanning bed. See, the eyes are covered and also the genitals. And they also make phototherapy blankets that parents can take home with them. Here's an extreme case of an infant, of a diabetic mother. You can see how large or macrosomic the baby is. This baby is at high risk for hypoglycemia. I have seen infants die in utero from moms not managing their gestational diabetes. And then sepsis, I don't think we covered in the sim lab, but there's subtle signs: temp instability, usually hypothermia, drainage from eyes or the umbilical cord, poor feeding, color changes, vital signs change. Group beta strep, we talked about during a previous lecture.